this is Dr. Khullar. We're here today to talk to you about constipation in kids. Constipation in kids is one of the most common causes of abdominal pain. I'm going to address symptoms, possible causes, and home management tips for kids at home. Before we continue, please make sure to subscribe to our channel so you could hear some more pediatric and mommy topics. So before we talk about kids, let's talk about infants. How do you know your infant is constipated? Just remember, it's not the frequency, but it's the consistency of the stool that determines whether the infant is constipated. I have some breastfed babies that may go every couple of days, even up to a week before they have a bowel movement. That is not considered constipation unless their consistency of their stool is pellet-like or very hard in texture. If the stool is hard in texture or pellet-like, that is when it's termed as constipation. So what do you do when your infant is constipated? Well, there's 4 home techniques that you may try. Number 1, if the child is on solids, you could make sure that you decrease the starchy foods in the diet. Number 2, you could increase some fluids in the diet if the child is gaining weight on their percentile curve. So for example, you could do a ½ an ounce of warm water mixed with a ½ an ounce of prune or pear juice, which equals 1 ounce, 1 to 2 times a day. This may help with the consistency of the stool over the next day or 2. Number 3, you could try rectal stimulation. Rectal stimulation is you could use an infant thermometer that you use to take your infant's temperature. You could use a little bit of coconut oil to lubricate the silver tip on the thermometer. When you enter it into the rectum, swerve it in a circular manner to see if there's any sort of stool impaction, which may be the cause of the constipation. Number 4, you may try belly massages. There is a certain technique to certain belly massages, and there are certain therapists which may help you with this. I will show you a technique that I learned that may be helpful to you. So if this is your infant in lying position, you can grab a little bit of warm oil and apply it onto the 2 fingers that are right here. You want to start on the right lower quadrant of the baby, right in this direction, and stay below the ribs. Make sure that you're staying below the ribs and go in a clockwise direction, making a question mark, just in that manner. So once again, you start in the right lower quadrant, massage, clockwise direction, and question mark. You can also try lifting the legs up and bicycling the legs, which may be helpful as well. So how do you know your child is constipated? There's a few symptoms you can look out for. Number 1, there is decreased frequency of the amount of stools that they have. Number 2, their stools may be hard and large and painful on passage. Number 3, they may present with abdominal pain. Number 4, they may have decreased appetite. Number 5, they may have a distended and bloated belly. And number 6, they may have some fecal soiling. So what are some causes of children having constipation? Number 1, there is a condition called withholding, which means a child may be so busy playing that they forget to go to the bathroom or they choose not to. They may have fear of public restrooms or public toilets. Because of this causes the stool to enlarge, and when they do have a bowel movement, it becomes painful and a memory that they don't want to repeat again. Number 2, sometimes they go on a toilet training strike. Number 3, their diet. This is the most important. They may not be having enough fiber or water in their diet. Number 4, a change in the routine of the child. Number 5, too many dairy products like milk or cheese in excess. Number 6, family history. Number 7, there may be some medical conditions, genetic, metabolic, or anatomic that may cause any issues with constipation. And number 8, not enough exercise. So, what are some ways you could treat this at home? You could definitely increase the fiber in the diet. Think of the pea fruits. So peaches, plums, pears, prunes, pineapples, which are wonderful. You could also do vegetables that have a higher water content like zucchini, and you can also make sure you decrease the starchy vegetables if needed. Make sure that you're increasing the water so that way they have enough for stooling, and also increase the exercise. You could definitely do a toilet training routine. Make sure after every meal that the child does have a routine to sit on the toilet, and make sure that there is a footstool if there's needed to help them position themselves. Definitely use some positive reinforcements in this case. You could use stickers, a sticker chart, or some treats that you could place in a jar specifically given for if the child does have a bowel movement or does comply with going to the restroom. Probiotics and fibers. Definitely consider probiotics or Culturelle with fiber. Another idea is magnesium for kids, which can be given in liquid or in powder form, which if given at night is very helpful to maintain your bowels. Miralax or polyethylene glycol is a medication that's prescribed by many pediatricians that is helpful to increasing the water load into the stool for the ease of the bowel. This is something that is also colorless and odorless. Mineral oil is another suggestion. However, this may not be something that the kids may like the taste of. Enema or laxative suppositories is something that is also a management. However, I would make sure that you consult your pediatrician before using either of these. If there is no improvement of the constipation after all these techniques, please make sure to discuss this with your pediatrician. If you found this video helpful, please hit the like button and comment below. Please subscribe so you can hear some more videos with similar content. All the content presented today was for informational purposes only and not specific to any medical condition or any patient. Always seek the care of a licensed physician for any health-related concerns. Thank you so much and have a good one. Bye.